bipartisan talks aimed at reforming health care until yesterday. Senator Orrin Hatch, a Republican out of Utah, has said he will ditch the discussions. He's walking away, and he's here now live to explain what happened from Capitol Hill. Senator, good morning.
Well, good morning. How are you?
So I'm doing fine, thank you. You're a Republican member of the Senate Finance and Health Committees. Why are you walking away?
Well, I just, look, these are all colleagues of mine. They're all great people. They're trying to do their best, but they've just reached a point where I know that there are things they're going to do and put in this bill that I just can't support. So I didn't want to be there under false pretenses, nor did I want to misrepresent. So I decided it was better for me to, you know, leave it up to them and absent myself, because I can't support some of the things
what are they talking about that's so objectionable to you?
Well, first of all, there's going to be a government plan, in other words, government takeover of the health care business. I just can't go with that. They'll talk in terms of co-ops, but the top liberal Democrats are saying, well, there has to be a national co-op set up by the federal government, with the federal government appointing the board of directors and, of course, funding it. And if we move towards the government plan, my gosh, we're $39 trillion in unfunded liability on Medicare. You can imagine what they'll do if they have the rest of the health care system as well. But
so it's the cost that bums you out then?
Well, both. That plus a lot of other things. Take the employer mandate. That's an employer mandate that's going to cost all kinds of jobs, especially for those at the lower end of the spectrum. In other words, those who are minimum wage workers who want to work but won't be able to have jobs because people will cut back on jobs. And even their director of the Office of Management and Budget agrees that they'll either reduce jobs or cut back on jobs or reduce payment or farm those jobs overseas. So that's a problem too. But
I see. Can I stop you there? Can I stop you just for a second?
Sure.
I'm trying to figure this out as we go. I know in your committee that they're talking about a co-op on the state level as opposed to a big national grand plan. Well, what is that? What is a state co-op?
Well, nobody knows right now. They have co-ops in agriculture, and it was an excellent suggestion by Senator Conrad of North Dakota, who is chairman of the Budget Committee, to try and come up with something that wasn't a government-run plan. Now, I was willing to look at that, but I have to say that the liberal Democrats are insisting that there be a national co-op set up by the government. In other words, a government plan to run health care. And frankly, if we do that, I'll tell you, we're going to wind up with a very poor health care system. Last but not least, you know, they want to move all kinds of people into Medicaid. They call it Medicaid expansion. And the Lewin Group, which is one of the best analytical groups on health care, said that if they do that, they will move about 119.1 million people into Medicaid. Now, why would we do that when they can't even handle Medicare? And Medicare is $39 trillion in debt. Why would we turn it over to the government? And one reason they want to do these things is because they want to really, I mean, the powers behind the scenes want to push this to a single-payer system where the federal government controls all health care in the country. And yeah, they'll deny that, and they'll say that that's not what they're doing right now, but that's the incremental steps towards a single-payer system, or
so that's what
other people will call socialized medicine.
Yeah, that's your read in committee. That's what you take away from all the discussions and the back and forth and the negotiations that you're hearing about. A single-payer system.
Well, there are a lot of... Right. Well, that's what they're ultimately pushing for. And if you listen to the president last night, he kind of spoke with admiration about a single-payer system. And, you know, to Democrats and liberals, having the government run everything is the way to go. I don't agree with that. I think the government will run things into the ground, and ultimately we'll wind up with rationing of care, especially for elderly people. And we'll wind up with you know, a huge bureaucracy that'll stand between you and your physician. I don't agree with that.
You mentioned President Obama last night. I want to play a short clip here from the back half of his press conference last night and ask you a very specific question about what's happening in committee. Roll this.
I have not yet seen what the Senate Finance Committee is producing. They've got a number of ideas, but we haven't seen a final draft. The House suggested a surcharge on wealthy Americans, and my understanding, although I haven't seen the final versions, is that there's been talk about making that basically only apply to families whose joint income is $1 million.
All right, so whether it's the House version or the Senate version, He says he has not seen the final version. That may be entirely understandable. However, within your committee, do you believe Democrats anyway have been given enough direction from the White House to figure out what the president wants ultimately?
No, I think the president has not really weighed in on this. You know, I understand that he doesn't want to have happen to him what happened to President Clinton, who did weigh in on health care. But on the other hand, he's got to roll up his sleeves, and without his personal involvement, I don't think we can get a health care bill done of any magnitude. And with his personal involvement and how liberal the president really is, and look, I happen to like the president, but there's no use kidding. He talks centrist, but everything he does is left. You're going to find an incremental push towards a single-payer system.
So you're saying the president...
But we're not going to get there.
I just want to be clear on
yes,
that. You're saying the president has not been engaged enough to get it done.
I don't know anybody who thinks he's been engaged enough, because you're not going to get a health care bill that will handle 1/6 of the American economy without the president rolling up his sleeves and saying, look, I'm going to get in there and help push this. Now, I understand why he doesn't want to. On the other hand, that's what leadership is all about. And frankly, he could lead here. He's a very influential, very well-spoken, intelligent man. And I think you can't help but like him. But you can't change 1/6 of the whole American economy without the president really weighing in strongly.
Senator Orrin Hatch from Capitol Hill. Senator, thank you for your time.
You bet.
Well, photos of detained